Hi, this is Dr. Philip Morphew, wellness chiropractor, energy medicine practitioner and intuitive healer, here to answer some of your most commonly asked questions. And Kayla's going to ask them.
What is wellness care?
Wellness care is a process of helping you be the best you can be. It's allowing your body to function at its optimal state and help your body stay in a state of homeostasis. Homeostasis means just a state of balance and peace and calm. And by doing that, we help you do that by helping you moderate your emotional patterns, clear any interference to the nervous system, clear any energy blockages, and more importantly, clear any uploaded DNA generational trauma or patterns that have come down through your DNA line. So wellness care is about basically keeping you good, keeping you well, and keeping you vibrant in this world.
Why do you crack my back?
Wow, that's a good one. I hear that all the time. Hey doc, oh great crack. Oh my God, you're gonna crack my back. Well, the answer is I actually don't crack the back. You crack eggs. But what we do is we specifically adjust the spine. Now, I could be using an activator, which is a little instrument, which is very, very gentle, a series of what we call SOT or sacro-occipital technique blocks to gently move the spine. We could use the drop table, and again, a very gentle process, or we can do a manual adjustment. Now, what happens is the adjustment itself is not the crack. The crack is generally just it's a wet surface, and what ends up happening is a little nitrogen bubble forms and collapses. That's where you get the noise. It's not like it's a very specific process and a very specific realignment, not just cracking.
Is it the same adjustment every time?
Well, that's a great question, because a lot of people have come to me after going to other places and they say, well, they did the same thing every time. Well, the answer is no, because the body is dynamic. The body is continually changing. It's either getting a little bit better or a little worse or continued stress. All of these factors come into the body. So in my practice, I individually look at that person to see what they best need and what the body needs that day. So as most of the people who I look after will attest, sometimes they just don't know what they're going to get that day because the body is showing me different things. Yes, there are certain areas that we look at, for example, the neck area, the mid-back area, the pelvis, and the general alignment. Now, there is a little bit of fine-tuning there, but specifically what's coming up in your body is what we work with in the effort of clearing the underlying causes.
Why do I have to come back?
Wow, I've heard that a number of times from people over the years. Why do I have to come back? Well, the answer is you don't have to come back. In our practice, it's about a choice. If you choose to address the underlying causes, then I would suggest we would follow a program of a plan. If you choose to stay well, then I would suggest that we can become part of your wellness team to help you get well, be well, and stay well. And for those people who come and they just have a little bit of soreness or a symptom, yes, we will help your body right itself or rebalance so the symptom subsides. However, the underlying cause will still be there, but some people choose just to have symptom care. That's okay. So as we say in our practice, it's your choice. How far you would like to go, how much care you would like to get, and if it's long-going care. Now, my passion is about ongoing wellness care to be able to help you be the best you can for the rest of your life.
Do I have to come forever?
Oh, come forever. Yes, I feel, I'm going to have to, you go to a chiropractor, you've got to go forever. No, again, like I said in the previous question, it's about a choice. Now, from my example, I got my first adjustment when I was 17, 18. Now, I've chosen to help chiropractic and wellness care look after my well-being, and I have done since I was 19 till now, and I'm only a couple of years older than 19. Not really. But I'm in that space where I regularly look after myself, just like my dentist. My grandfather was my dentist, taught me that brushing my teeth, flossing my teeth, and looking after my teeth, if I do that, they'll look after me for a lifetime. Now, people who want to look after their well-being and be their optimal state often choose to let me look after them for a lifetime. I've got people I've been looking after for almost 40 years, and they are well, they take little to no medication, and they are functional, independent, and vibrant.
Why maintain my well-being?
Wow, why maintain my well-being? Well, again, it comes down to a choice. You may notice that you see people in the supermarket and buying lots of cigarettes or lots of soft drink or lots of processed foods, and you often maybe wonder why they would do that. Well, a lot of the times people don't look after their well-being because they don't either know how to, or they are emotionally stuck, or they are in a situation they don't even understand what is causing them to not look after themselves. But if we look after ourselves, our well-being, our body looks after us. Now, none of us want to get to the end of our life and be sitting in a chair drooling, or lose our independence or our mobility or our clarity of our mind. But looking after your well-being, good nutrition, plenty of water, mild to moderate exercise, just walking or even swimming, a regular realignment of your spine and your nervous system, clearing any emotional patterns that build up, definitely clearing DNA uploading or the generational traumas, all help you stay well longer and maintain your vitality. So it's your choice whether you want to look after yourself for your lifetime. My choice was, absolutely, that's what I'm doing.
Why do you make noises?
Oh, that's funny. Anyone sitting in my reception area will hear noises coming out of the room. And that's generally me, not the patient. Now, the noises that I might be a or a or a and what's happening there is, as I've explained in one of my energy videos about energy release, it's releasing energy that's come through your system and basically out from me. Anyone who's seen the Green Mile, it's a bit like the Green Mile, except bugs don't come out of my mouth. So in simple terms, it's like a bottle of Coke with some Mentos in it and the lid on. So there's a build-up of pressure. That's your body, okay? Now, when the noise or the energetic release occurs, which sometimes is mild, sometimes really loud, is the equivalent of me taking that lid off and letting a little bit of that pressure out, okay? And that helps release the pressure in your body. So that's where pretty well all the noises come from.
Is it safe to bring my kids and get adjusted myself?
Well, is it safe? Yes, it's safe. All the techniques we do are very gentle. I'll give you an example. Each of my 4 children, we have checked immediately at birth, but before that, all through the pregnancy, I was adjusting and tuning my wife and our in utero baby energetically, emotionally, and structurally, all the way through to the birth. And then after Marie gave birth to our children, then I would check them. Now, the 2 boys on either end had a really horrendous birth, so they need a little bit more care. The girls basically were slip and slide. They were out, need less care. So the type of care is about the same for the babies, is about the same pressure as you just gently tap your hand on your finger on your body. Very, very gentle. Maybe some cranial work. It's not some big cracking or moving or specific adjustment that way. It's very gentle. And we've been looking after, for example, my kids, 31, 29, 24 and almost 15, have basically got through life without any antibiotics or any prescribed medications because they've been well. So a regular, gentle, safe care for children and babies helps them stay well, helps them avoid having to have excess medication, which ultimately, as we know, impacts the gut. And if the gut's out of balance, impacts our brain, long-term, not good. So, but the work we do is very safe. And for you, the best thing if you're a mother or a father is we get you energetically aligned with your children, because you're on the same energetic network. And if there's stuff going in here or in here that's not so good, that goes directly to the kids. So it's good when we can realign all of you. And that's why we look after families and do a lot of family care and multi-generational family care. So remember, safe, gentle, and effective. That's the work we do.
What if I only have a sore back or sore neck?
It's just my neck or it's just my back. I hear that a lot for different people. Well, the fact is, the soreness in your neck is not just the soreness. It has taken a process to get to the point where the body goes, I can't do this anymore, I'm going to give the person pain. It's like giving them a tap on the shoulder which says, do something about it. Now, generally, there are underlying causes. So, for example, we can have a sore neck, but the problem can be coming from the lower intestine or the gut, or the liver, or the stomach, or the lungs, which can be reflexing back into that area. Also, if we have an emotional overload, we can't get stuff out and we hold everything in, posturally we change. And when we posturally change, everything has to work harder. So the key with just a sore back, that's fine, but my suggestion is look at the underlying cause, because otherwise that soreness will go in and around and it'll become a circular pattern over your lifetime unless you address the cause. And if you do, then you're going to have a better, more vibrant and healthier life.